Enough Live. I'm Erin Erickson here with my mom, Marti Erickson, and we are so thrilled to have this Facebook Live today with our guest, Dr. Kerry Brockberg. We are going to be talking about hope and helping our veterans fight pain and addiction. And for those of you who don't know, more than 1 in 10 veterans struggle with a substance use disorder. So this is a hugely important issue, and we're so happy to be able to share this episode with you today on Veterans Day with support of our supporting partner, the Hazelden Betty Ford Foundation. Our guest, as I mentioned, Dr. Kerry Brockberg, she is a licensed psychologist working in the field of rehabilitation. Her current practice focuses on individuals with chronic pain, brain injury, and other chronic illnesses and disabilities. She specializes in the development of tangible psychological approaches connecting the mind and body in better understanding of overall functioning and for supporting quality of life. So definitely a focus that is near and dear to my heart, as well as a clinician doing a lot of mind-body medicine practices, which can be so powerful. Kerry and her husband co-authored the book End Your Covert Mission, A Veteran's Guide to Fighting Pain and Addiction, which is released this month, November 2022, and is published by the Hazelden Betty Ford Foundation. So we're just thrilled to be able to share Kerry's story and her wisdom with you today. So thank you so much, everyone, for tuning in. And thank you, Kerry, for joining us.
Thank you for having me.
Hi, Kerry. I'll welcome that or echo that welcome that Erin provided. I want to also, before I dive in with a question for you, I want to just ask you a personal question because I heard that you have twin babies. Is that right?
Yes, identical twin baby girls.
Oh my goodness.
They were born in April. It was quite the journey with them, and it has been so fun. I'm a new mom, and it just is also exciting. So
well, that's wonderful. And we'd love to talk with you sometime about that experience of parenting multiples, because I know that's its own kind of parenting journey. And my father was an identical twin. And I have a lot of interesting stories about that. So sometime maybe we'll chat over coffee about some of those things, but certainly of interest to our audience as well. But you really do have an important story to bring to our listeners and viewers. And I wonder if you could start by telling us a little bit about your own background and that of your husband, who is your co-author as well, and what inspired you to write this new book. And the title, I think, is really interesting, End Your Covert Mission, A Veteran's Guide to Fighting Pain and Addiction. But what was it that inspired you? I know there's some personal elements of that for sure.
absolutely. Well, first, I also want to just say, Happy Veterans Day. Thank you for your service today and every day. I think that's an important thing too. Although we have these holidays, of course, we just are so fortunate and lucky to have our veterans, and that kind of connects back to our personal connection. Dustin is also a veteran himself. Dustin and I met in grad school when we were both completing our PhDs together. And, during that time when we started dating, he was I had a few family members that were service members, but he was probably the first closest person to me that I actually got to talk to that had served. And, throughout our time of dating and even now, in married life, one of the biggest things for us to join together and understand each other a little bit better was him sharing his stories with me about his time in the military. And every time he shares something, I learn something brand new about him, the military experience, and it just has brought us so much closer. And recently, so I guess not recently, last year when I was pregnant, actually, he was approached by Hazelden about writing this book for veterans and folks that struggle with substance use. And he was like, absolutely, this sounds great. I would love to bring my wife on with my chronic pain background. And a lot of times in how we understand veterans and substance use is that there's a lot of pain that individuals go through. Our book talks about physical pain, emotional pain, social pain, And Dustin definitely shared those things with me throughout our time. Even writing our book, I learned so many new stories from him. So the idea with End Your Covert Mission as the title is the idea of we don't need to suppress our pain and addiction issues. And it's so important to get out what's going on for yourself as a veteran. And we know too, I think that a lot of times veteran service members, they were actually trained to conceal a lot of things because they had to keep going and keep going. So that's something that we talk about, is like kind of getting rid of that old gear, that old training that you have that isn't as effective anymore, in the civilian world. So
Oh, wow. What a
yeah.
beautiful story though, too, about you two connecting and learning more about each other in this process. And we have many family and friends who are veterans, and we're just so grateful for all of our active and retired military members and their commitment to service. And so it's really an important day, but every day we should be thanking our service members, as you said. I think that's so important, but especially today to bring forth this issue feels so important. As a clinician who works a lot with people who have chronic pain, I've definitely come to see, that there's the actual pain, and then there's sort of the pain of the pain, just the suffering of kind of living with the pain. And so maybe in some ways, even that becomes bigger so much for people who are living with pain. And it becomes really important then to develop tools and techniques to kind of increase that quality of life, which I know is what you're doing in your work. So I so appreciate this topic. And I think it's so important. And I especially appreciate what you shared about just that idea that maybe in the military you need to be focused on your mission or your task at hand, and that your own suffering kind of has to take a back seat, or what you're dealing with in your life. And we know that veterans, especially when they're deployed, they're dealing with separation from their family, and there's so many factors that are involved in that, and so much of that has to be held in this other space while they focus on the task at hand. And so I really appreciate you bringing that up, because I think that's something we often don't consider as part of this huge sacrifice that people make to serve, and that in so many ways they have to kind of set aside their own kind of challenges and things that they're dealing with. So what makes pain and addiction such an important topic for veterans?
Yeah, it's such a good question. Pain and addiction, we just feel that they're so intertwined, and they're very similar in the respect of how they're an ongoing difficulty that people experience. So, um, the nature of pain is that, especially chronic pain, is that someone is experiencing this over time, longer than the expected amount of time to heal from something. So, which kind of sets it apart from like an acute pain issue, right? And addiction and recovery, right? That's an ongoing commitment in itself, and working through the recovery and that day-to-day process. And it's really important how we understand those two together, and how someone experiencing the physical issues, just like you're saying too, Erin, the idea of like physical pain kind of sometimes at the beginning, and then it impacts other types of pains as well. And oftentimes we can see people, self-medicate for that reason, maybe using substances to help with the feelings of pain, whether that be physical or emotional or social. And sometimes we start to see folks experience pain after they're using. So it's really this interconnected, interchangeable thing that happens. Not everyone that has chronic pain uses, and that's important too. We don't want to generalize for any reason. There's a big difference between folks that have chronic pain and are taking their medications appropriately or doing things appropriately. But it can be a huge risk factor. So those two topics are so important because they are intertwined so much, and we really see that be a major issue for a lot of people, a lot of veterans too. So.
Yeah, and I'm so glad you brought up that point about just, there is, lots of people use medications appropriate to treat appropriately to treat pain. And it's important that we continue to have access to medications that are effective for treating pain and really distinguishing, between kind of this maybe appropriate or medically indicated use, and then when things veer into substance use. And I know, and we know that oftentimes addiction does have its roots in appropriate prescriptions for pain medication, and then that can sometimes lead to addiction, because we don't always know when we're first prescribed a medication if we even have, that risk for addiction. And so oftentimes people are using medications appropriately, and then we just don't know before they're prescribed, even if they are potentially at risk for developing an addiction or substance use disorder. So I think that's such an important distinction, and an important thing for us all to be aware of, that there's maybe lots of different ways this can look. And so that's hugely important.
Yeah, I think too, like as you're talking through that, I'm thinking about just the amount of stigma that can come with chronic pain, and addiction, in that, just people not understanding and making assumptions that are inappropriate and difficult. And it makes a lot of people very uncomfortable to open up and talk about these issues. And that's a big part of our book is, we're really urging people to do that. So in that same respect, like trying to create a space where folks do feel comfortable and that they're not feeling judged or misunderstood. And these are two topic areas or experiences that often get kind of categorized into that stigma category. So
yeah, and I know for many of my patients who are struggling with the disease of addiction at all different stages of recovery or the journey, that one of the things I hear time and time again is they want to be seen for all that they are, beyond just this one part of their life, which can be a huge and important and challenging part. But I think as a clinician, it's just so important, and as a community, that we really don't ignore all the other parts of a person's life, because I think so often it becomes, this is the identified issue at hand, and then we lose sight of all of the many parts of this person's life and their connections and all the good that they've done, and maybe their careers and all of these things. So that becomes really important too, just that we kind of create the space for everything that a person is in the context of this.
That's a really important point, Erin. And I'm thinking, Kerry, as you were talking about the importance of having a space to be able to bring things into the light, to bring these issues out in the open. And it seems to me that the military culture and the veteran culture, which are, certainly related, but not necessarily exactly the same, can be a challenge. There are a lot of assets to those cultures as well, I think. But to what extent do you think, and in what ways, does the military culture or veteran culture increase the risk of addiction in these kinds of circumstances?
I think that one thing that we could see is that there are certain social gatherings or social connections that sometimes veterans or within the military too, when we actually we did interviews for our book, which was probably the coolest part about the book, is we actually reached out to veterans about their experiences with substance and addiction. And several of them had shared with us and opened up about just different times while they were serving where alcohol or some sort of substance was involved because there was a celebration or maybe difficulty that they experienced. So kind of a part of that culture, maybe within the military. And then maybe even outside when folks leave, still trying to manage some of those difficulties or, end up experiencing something later. I think that's also something we really try to hone in on, is we can't also pigeonhole that because someone was in the military that they all have an addiction issue or they will have an addiction issue. Some folks come in prior to their military experience already having issues with substances, and then that kind of maybe can get worse, within the military, and then afterwards trying to cope or deal with some of the aftermath, the difficulties of transitioning to civilian life. But I think that with the struggles and challenges, though, one thing that's amazing about the veteran community is the resiliency that these folks have developed and been through in their lives, which I think makes them have protective factors when it comes to dealing with their pain and addiction. And even more so to that, the community itself is just absolutely amazing, just how connected and strong these folks are, and keeping together, knowing when times are tough, they can reach back out to their brothers or sisters and get some support. And I think that also is a protective factor for dealing with pain and addiction. So
yeah, I've definitely seen that those strong connections and family members and friends who are veterans, just how they like, these very much are their brothers or sisters, and in their kind of this shared experience they had together and the lifelong connections, which has been so important to my family and friends who are veterans. I'm also just thinking about this idea of culture around substance use. And I mean, I think that's very much a part of our culture as a country too, that alcohol is a huge part of so many social gatherings. And I've really appreciated a trend that I've noticed, at least in our community, where a lot of restaurants are doing more around mocktails or non-alcoholic beverages, and event organizers are being a little more tuned to that. And I know when we've had our Mom Enough events, we always have a mocktail, because we want people to have lots of options, and to really not have the focus be on alcohol, which I think it so often is. I mean, even parent gatherings at schools often involve alcohol, or church or other religious gatherings will involve alcohol. And so I think it's so much a part of our culture, and even just that, like, oh, you've had a hard day, let's go to happy hour or something. And that, it'd be really cool if we could see a shift in our culture of like, oh, you've had a really hard day, do you want to go meditate together? We could really make some shifts culturally around that too, regardless of our status as far as being in the military or veteran. But I think I know that the VAs are doing so much around this, and yoga, and there's been a lot of interesting research on yoga and trauma and military, and a lot of integrative health approaches being implemented with mind-body medicine. And so I think these are actually, what I've observed is that a lot of this really amazing research around this is coming out of the VA system. And so I think that's a really positive shift and movement, and kind of shifting the dialogue and creating opportunities for other tools people can use to manage hard times.
Absolutely.
Yeah. So, well, the title of this event, as we've posted and shared, is a story of hope, and this is part of a 3-part series that we're doing with Hazel and Betty Ford Foundation, and we're just so grateful for our partnership with Hazel and Betty Ford Foundation, bringing all of this amazing information on the disease of addiction, and stories of hope is such an important part of that. And so, can you tell us about where the hope was in your story, and tell us a little bit about your story and how hope is realized for others who are struggling with pain and addiction?
Yeah, absolutely. I think the biggest hope that we have from this book, and even our personal professional connections to working with veterans that experience pain and addiction, is the idea that you're not alone. And not being alone is so important. When someone's going through pain or addiction, it feels very isolating. It feels that no one understands, no one could possibly be experiencing what I'm experiencing right now. And in some respects, right, all pain, all addiction is different. Everyone has their individual journey with that. But there is the relatability piece here of, you're not alone. There are other people going through this. And by opening up and sharing and understanding that sharing can bring about relief, might help veterans feel better and feel different. And that's a big big part of why we wanted to write this book. It's a big part of why, even personally, between Dustin and I, that we talk about these stories that he's gone through. And I learn more and more every day, and it makes our relationship that much stronger and strengthened. And, even professionally, when I give space to my clients that might be experiencing issues with pain or addiction, I think they find a sense of relief of like, wow, I didn't know it would feel like that sharing that with you. And um, we've just seen such good outcomes when folks open up. And that's why the book tries to give so many different tools on how to do that, who to do that with, how to develop that sense of comfort. It's not an overnight thing where you just say, oh, I'm going to open up today. This feels like a great idea, right? We have to develop that trust and respect and find these, folks that you do feel comfortable with, whether that's another veteran, a family member, a friend, maybe a therapist, trying to find that space to do that. And what we know is that it could feel different. It could feel better. And that's the hope is, right? When you're dealing with pain, when you're dealing with addiction, or you're in recovery, we want you to feel better. We want life to feel good. And that's the big part of, my work and our personal life together is quality of life is so important, right? We get one life and each day should feel good. So that's our big hope with this book is like, if you can find one thing or just one concept that just like makes a difference for your day, we would be so happy. So
Oh, that's terrific, and that is hope. That's what we're talking about. And I'm thinking about the fact that Dustin, your husband and co-author, is working at Hazelden Betty Ford, as you mentioned to me before we went on air. And just curious about, at what point in his own journey, being a veteran, did it become clear to him that he wanted to do that kind of work? And obviously, reaching out to other people, not only veterans, I assume, but people who are kind of having those challenges and looking for the hope that you can provide. So, what was that like for him?
yeah, Dustin, it's funny, I think he's always had this call to work with veterans ever since he left, the military himself, or not left, but, ended his time with the military, the Army. He knew he wanted to try to make a difference for veterans with his own experience, his own transitioning. That was a big part of his call. He's like, I need to try to make a difference. So many people had made a difference in his life that he shared with me before, and he's very open about this. He would not mind me sharing. And I think that was his call to psychology and to, wow, a lot of people made a difference in my life. I want to do that for others. And it was interesting. We both have members of our families that have gone through their own addiction and recovery experiences. And the way he tells it is that, he found himself just back in these settings that were related to substance use and really seeing how pervasive an issue this is for veterans, and just wanted to make a difference in that way of how can we support, how can we know that, and help people know that this doesn't have to be the only option to cope and deal with things in life, right? Because a lot of times folks that are using, there is this like numbing sensation we're trying to get through, or for whatever reason, there's a lot of different things that go into that. But yeah, and he's so lucky. Hazelden has been a great place to work, and we feel so so much gratitude for that. So
Well, we feel that too, just having this partnership with Hazelden Betty Ford Foundation. And it's really been a learning experience for Erin and me, just to have all the experts from Hazelden, including authors who've published books with their publishing arm. And it's just been one of the richest things. Erin and I have been doing this for 16 years, 4 years
Wow.
live on the radio, and now 12 years as a podcast, and doing these Mom Enough live events on a regular basis, not every week like we do the podcast, but it's just been one of the richest learning experiences, because it's something I don't think either one of us had a whole lot of direct experience with, but we've really come to view these issues differently. And I just love the thought that Dustin and you are bringing your firsthand understanding to the work that you're doing. I think there are a lot of people in mental health work, and as psychologists, I know I bring my personal, some of my own personal pain and difficult experiences from growing up that really show up in my work and have really put me on the path I've been on for more years than I want to count at this point. But it's really a powerful thing, I think, when that can happen.
Absolutely.
Yeah, well, I'm wondering, first of all, I just want to remind our listeners, the title of your book is End Your Covert Mission, A Veteran's Guide to Fighting Pain and Addiction. And we just so appreciate your expertise and story. And I can only imagine just how powerful that is for your patients, for both you and your husband, your co-author, and just how meaningful it is that you can share your personal experience and your story of hope, and support others in finding that hope for themselves as well. And so again, this book is published by Hazel and Betty Ford Foundation, and the Hazel and Betty Ford Foundation is supporting partner Mom Enough, and they're making this episode possible today. But I would also just love to know if you have parting words for our listeners, if something that you would want to leave them with.
I think the biggest thing that I would love to leave listeners with is just being open and being flexible with veterans or non-veterans, anyone that's experiencing addiction or pain, trying to come and create a space where someone doesn't feel judged or misunderstood. And that can really just come from the idea of being open and curious. I think that's something that a lot of us can struggle with from time to time, but it makes a world of difference for someone that is trying to open up and get through what they're getting through with pain and addiction. So
Wise words, Kerry. Again, we're talking with Dr. Kerry Brockberg, licensed psychologist and co-author of End Your Covert Mission, A Veteran's Guide to Fighting Pain and Addiction. I so appreciate those words. And as I often say to my patients, I don't see this any different than any other disease that someone would struggle with. And, we would never identify someone as, oh, you're, the patient with diabetes, or you're the patient with cancer. We would see them for all that they are. And we need to do that for everybody, regardless of what their health or mental health status is. And as I often say to my patients and my kids and family is, mental health, having mental health isn't the absence of mental illness or struggles. Mental health is having the tools to cope with what you have on your plate. And I think that is a hopeful message too, that we can all build and grow and develop the tools we need to manage our health and mental health. And Hazel and Betty Ford Foundation is an amazing resource for people who need those services as part of their journey towards health as well. So thank you so much, Kerry, for joining us. This was wonderful. And thank you to Hazel and Betty Ford Foundation for your support and for continuing to provide amazing resources with evidence-based information on the disease of addiction. So we greatly appreciate that. And thanks to all of you for tuning in. I'm Erin Erickson here with my mom, Marti, and this is Mom Enough Live. We hope you'll tune in again for our next episode. And we have 2 more as part of this series. So we hope you'll tune in. Thank you so much.